Okay, hello everybody. Welcome to Board of Health for the month of March 2021. It's nice to see everybody on this beautiful day. I hope everyone's getting a chance to enjoy the beautiful outdoors the last couple of days. Let's go ahead and get started. Frank, I don't think we have anybody for privilege of the floor, correct?
I don't believe so, no.
So we'll go ahead and move on to approval of the February 23rd minutes, which are part of the board packet. So can I get a motion on the minutes, please, for approval? Okay, I've got a first from Sue and a second from Melissa. Any discussion? Okay, all in favor as written? And I think that's unanimous. I am not missing any of our voting board members. Am I 1, 2, 3, 4, 5? No. Okay, great. Financial summary, Frank.
Yeah, I don't have anything to add. Was there, I apologize, I don't even know if there was a.
It's in there.
Okay.
Yeah, it's in there.
Yeah, so we're still closing out. Last year, I know Karen Johnson's getting close to having that, and then they threw us a bit of a curveball. I don't know if I told you this before, but there was some confusion because Article 6, our state aid, requires that it be the payer of last resort, as does FEMA. And so they can't both be the payer of last resort. And so there was a bit of confusion at the state level. And we just got clarity, as we kind of expected, that FEMA is the payer of last resort. So Karen's having to go back and do some recalculation on Article 6 state aid to try to figure some of that out. So this is going to be probably our most challenging budget year, both from a amount of money available as well as just the complicated nature because of all of the moving pieces with it. So we'll keep you guys updated as we figure out how the year is closing out and how we're going to move forward.
Okay, any questions for Frank? Okay, can you keep going, Frank? Because I think you're next for administrative report.
Sure. So as far as COVID update, we've the disease issues since the last time we met, we were heading in a really good direction. And then we've had a little bit of an uptake in the last few weeks, and we're not going to blame Sue and Dr. Capel for it, but it has been college student based. I think if you look at the Cornell tracker and you've seen the announcements from President Pollock, we're having some issues within the student populations there. I think there's a lot of fatigue, right? Particularly because Cornell was open last year. This is now a second semester that they're having to try to push through with all of the restrictions. So I know that Cornell is working hard to try to address the students and deal with the things that are popping up from a case perspective. So outside of that, in the general population, case numbers are still fairly low. And continue to trend in that direction. I've been asked the question several times, have we seen kind of crossover from the Cornell cases into the community at large? And we really haven't. It's been mostly contained to the student populations at this point, including faculty and staff at Cornell. There's been very few cases amongst that group as well. So it could be better, but we're still I think in an okay place as we continue to focus on vaccines. The guidance is shifting on reopening. Quite a bit has been happening. Liz and her team are doing an amazing job of trying to keep up with it all and communicating with partners about how those changes are occurring. The next big one, I think, is April 1st. The travel quarantine becomes a recommendation and no longer a requirement. So those folks traveling domestically do not need to quarantine upon return to New York. So that'll be a big change. The one thing that we don't have clarity on yet from the state is related to a PK through 12. The CDC, are probably aware, shifted their recommendations to 3 feet from 6 feet. And so that now has the New York State guidance being more restrictive. New York State guidance does allow to go below 6 feet, but it requires an impermeable barrier. The CDC recommendation does not. So we have not gotten an update from the state on that. I have met with the school superintendents. They're rightfully frustrated with the lack of clarity on this. And quite frankly, there are districts around the state that are just going ahead and doing it in varying ways. So really the best scenario would be for the state to update its guidance or tell us it's not going to, but some reaction would be helpful. So we're continuing to apply pressure in that area as well. On the vaccination front, things are still going well. We received 1,770 doses this week. That is our kind of base allocation that we're getting now. The last 2 weeks, we got an additional bolus of Pfizer vaccine, which allowed us to do, almost 3,000 people each week. We don't think we're going to get that this week, so the 1,770 will be our allocation. We have not received any Johnson & Johnson yet. So we're still asking for that every week. We don't expect that we'll see that likely until April, is what the state is telling us. We have roughly 16,500 people on the registry. We've had 23,000 total register, but as we vaccinate people, we take them off. And then, of course, new people come on each day. So we are still using the registry. I will tell you, when we did the nearly 2,000 doses of comorbidities last week, we sent a direct email to 5,700 people from the registry and did not fill those 2,000 spots. All right, so we're finding that people are getting their vaccine other places. Some people are waiting for a particular vaccine. Some people are waiting for a convenient time for them to get their vaccine. So we're starting to, see that shift away from people's willingness to come get the vaccine in any form at any time that we're able to give it, to getting into the population that's going to want it when it's convenient, and when it's convenient for them in the way that they want it. So we're still working through the registry. We'll continue to do that this week. We're going to focus on the 1A and 1B workers this week to try to hit a large population of them. I think we have roughly 5,000 folks that we're going to be sending the email out for just under 2,000 slots, because that's the ratio that we've had to do to kind of reach folks. So we'll be doing that this week. A press release will likely be going out later today announcing that. This week, for the first time, 3 local doctor's offices received 100 doses. So they're going to be trying to administer those over this week. I've reached out to all 3 and offered support if they need it. And we'll check in with them later in the week to see how that goes. I'm interested to see how successful they are. I think it's going to be a bit more challenging than they're initially imagining to first find 100 people and then administer the doses within the 7 days time frame that they have to get them done in. So we've been communicating with them, and we'll continue to check in with them. Since our last meeting, we had our second dose for the pop-up down at Beverly J. Martin, which went very well. We're able to use all the doses, went a lot smoother, no technical problems this time. So it was a really good event, and it was predominantly health department staff, our nurses and administrative folks and some other county staff with some CMC folks mixed in. So that was a good, successful event. And we've also now either brought to the mall site or gone out to all of the income-based senior housing facilities in the county for their first doses, and are in the process of moving on to their second doses. So that is going well. And Reach Medical this week will be doing their fourth round of homeless folks. So they've done, what, 53 to date, and this will be another 20. So they get the vaccine from the mall site and take it up to the homeless population. So a lot of work going on to get to those hard to reach populations. We continue to plan for additional pop-up locations when vaccine supply warrants, and we're also working with community partners on farm workers, understanding that they may be a difficult population to reach, particularly if we have to do them with 2 doses. So a lot of work going on around ensuring vaccine is available in the community. And that's all that I had, Christine.
Great, thanks, Frank. Any questions from board members? Sue?
Yeah, I was wondering if there was any talk about trying to vaccinate some of the students, or they're just on the New York State bottom of the list because they're young and healthy.
Yeah, a couple of my colleagues have made that argument to the state in the last couple of weeks. It's hard pressed to move healthy young people ahead of, older comorbidity folks and folks with comorbidities. So I don't think that's likely to happen. Yes, they are the population that is showing cases right now, but it's still probably better to focus on the people that would have the most adverse impacts to make sure that they are protected.
Great. Other questions? Thanks, Frank. Health promotion program.
Hi, everyone.
Yep.
Hello. So just, working on continuing with updating, our weekly updates on the vaccination and promoting the vaccine registry, trying to get out in person a little bit more to distribute the information about the vaccine registry and talk to people about getting the vaccine. We're continuing to update the website and just keep that as up to date as we can, but things are changing quickly still. And I just wanted to share that we have a new poster that says "Together" at the top, and it has some reminders about continuing to wear masks and keep distancing. And it also includes getting vaccinated when eligible. So we've been pushing that poster out to businesses and the community who had posted our original flyer. And this one's just an updated one. So I can also put it in the chat, but any of you, you're welcome to share it and post it and share it with your networks. So that would be great. Thank you.
Thanks, Sam. Any questions for Sam? Okay, great. Dr. Claypack?
Well, good afternoon, everybody. As you said, it's a beautiful day out there. I dovetail on a little bit. Well, let me start first, I think, by saying I hope I'm not overburdening you with too much information in my reports. Some of that information I've selected out from the weekly practitioner bulletin that I do to practitioners in our region, looking for items that I think particularly might be interesting for the Board of Health. So it's pretty extensive, but I hope it's useful. I dovetail on to what Frank was saying about private practices and the rollout of the vaccine. There is a niche for private practices at the proper time and place. Some of these resistant populations, resistant people, have told their primary care physicians that they won't get the vaccine until their doctor gives it to them. And it's that personal relationship that for some segment of our region's population will be important for them to get the vaccine. Other people just plain don't come into Ithaca. it's always been true out in Dryden, for example. Oh, no, I wouldn't drive down into Ithaca. That's a lot of traffic, and people in Trumansburg say the same thing. So to some extent, it's that type of thing that goes on. And some of the resistant people who have gotten some misinformation can be persuaded by the private practitioner. So there'll come a time when they come into their own, I'm sure. You've been reading, I'm sure, in the newspapers and so on about the continued problem in getting nursing home and long-term care facility staff vaccinated to appropriate levels. And we, in the last couple of weeks, have been in close touch with a couple of key people, and Frank has done an awful lot of work being in touch with these facilities. And we've tried to do everything we can in terms of supporting that vaccination effort and getting the percentage vaccinated up to reasonably high levels. Perhaps it'll be helped a little bit by having the Johnson & Johnson vaccine when it's available. It's a different vaccine. It's not an mRNA vaccine. That vaccine and the AstraZeneca vaccine use a technology that was used with Ebola virus and is used currently with Ebola virus vaccine. That vaccine, Ebola, has been tested and used in a very, very diverse group of people, including pregnant women. And so if that carries any weight with people, it's not a brand new technology, although mRNA technology goes back to at least the SARS epidemic, as you know. So it too is not exactly new. It's been around a long time. But we'll need all of these strategies, as I mentioned in my report, in order to get to community immunity, to herd immunity. And it'll be important, especially with certain populations. If you have any questions, I'd be glad to hear them and try to answer them and respond.
Melissa?
Are we collecting data on who's being vaccinated? I had a question about the BIPOC population and if we have data on that and how many people are in community. So we know where to reach out, I guess.
Yeah, I think Frank probably has the best handle on responding to that. I know it's difficult because there's no one repository for collecting all the data through the vaccinated people, through pharmacies and all the other outlets. Frank, perhaps you're in a better position to answer that than me.
Yeah, actually, there is a place, NICIS, the immunization, New York State Immunization Information System. All vaccines have to be reported in there within 24 hours, all COVID vaccines within 24 hours of being administered. We are pulling the information. We will likely have that in our legislature report for Tuesday. We have put it out before. It doesn't align with our census data. It doesn't. We're behind in people of color. Part of that is the initial populations that we were able to vaccinate were not the general population. So it was age-based and or profession-based. And so within those professions, you don't have the same distribution of people of color as you do in the general population either. So it's a little hard to make one-to-one comparisons, but certainly as vaccines eligibility begins to open up, we're going to be paying close attention to that. And I think likely our first pop-up, our next pop-up will be designed to try to reach those populations.
Great, thanks. Other questions? Okay, and just so board members are paying attention, Sam has put a lot of great links into the chat. If your chat isn't open, if you're looking for links to any of the things that are being discussed right now. Okay, Claire, Division for Community Health.
Hi, everyone. Yeah, I guess in general, we've seen, and it's important to call out, great stamina and collaboration among the team of investigators and contact tracers, monitors of cases, people responding to calls. riding out lately fluctuations in volume of cases and calls. That's been a challenge. And we've received continued support from environmental health, CSCN, health promotion, and the data teams. That's been really critical. I would just say, as Frank said, we're entering a new phase of the pandemic here in Tompkins County. So while hospitalizations are down, it's great. We are experiencing a reverse in trends that we saw last month with a significant uptick in new cases over the past weeks. And that is especially among young people. We are seeing these 3 variants that we have of the virus, UK, California, New York City. Sam's team put a press release out about that included that information yesterday. And so essentially we're really just working to engage the community and continue to support each other to be vigilant. And, you know, I just reiterate that we're not out of the woods yet. And we really need everyone's help to get through this. So aside from that message, I would just say we're beginning to start up timidly some of our non-COVID community health work. As we've indicated in the report, we have 2 vacancies that are still open for permanent community health positions. We'd really like your help in recruitment, sharing with your networks, and promoting that actively. These are great positions, and the position can be what people are looking, you know, what they want it to be. So please encourage all those who are interested to apply. I also wanted to add the Wic program has been continuing. They run strong, providing services remotely since, as they have basically since the beginning of the pandemic. Enrollment participation is high, and we'll be including figures and updates on the Wic program again in the written board report starting next month. That's it.
I would just add that Claire and Rachel Buckwalder, and amongst other people, have been spending a lot of time with coordinating with Cornell, for example, making sure that we have a unified approach to the cases that have arisen. And you just have to keep doing that over and over, not because we change so very much, but sometimes the challenges change. And the messaging and the way we're handling the cases and what we're telling students and parents and so on is very closely coordinated.
Great.
Thanks, Dr. K. Yeah, it's really about framing expectations at this point. I think we are ready to be done with it, but the virus is not quite ready yet. So we have to kind of help to shape expectations together. And something that we've talked about with Cornell is how do we frame the conversation and our interventions. We're not doing it to students or, we're doing it with them. So they have to be part of this as well. And we want to treat them like the responsible, engaged, committed adults that they are, young adults.
Great, thanks. Other questions for Claire? Okay, children with special health care needs, Deb.
Hi, everyone. We continue to just provide some support for the disease response, but not needed as much. So we're continuing to provide some support for the vaccine clinics. Other than that, our programs are running full steam and doing well.
Great, thanks, Deb. Any questions for Deb? Okay, Jonathan, County Attorney's report.
Having trouble finding my mute button there. I do not have a report.
Okay, great. Environmental health, Liz.
I guess the only thing I would mention is Frank mentioned, everybody's mentioned, a lot of things have been changing very quickly. Cuomo has made a number of announcements about weddings and other types of gatherings. And and some of the dates have already taken effect, but they have not updated the guidance like they have in the past. And in some cases, they have been an executive order change, and in other cases, there haven't been. So I'm going to be meeting with Frank to make sure we're all on the same page as to how we proceed with this. But you know, there's a lot of changes, right? You can have weddings up to 100 people right now, it appears, based on announcements, without any notification or testing required, which is different than what's in the guidance. And it keeps opening up through April 2nd with increasing sizes. So we'll update our website. I want to make sure we're putting on the website what we are going to do in the lack of specific guidance. So no real update, just making you aware of the changing situation and that there isn't specific guidance. We're also hoping to see guidance on graduations. Don't know where those fit into the mix either at this point. That's it.
So Liz and Frank, is your intention to implement based on what the governor has said, or is your intention to continue to monitor based on what's in writing?
So I think I want to talk with Frank and then respond.
Okay.
And he's going to be meeting with me right after this. So I'm not sure what the intention is, so unless you want to go ahead and say something, Frank, and then, you know, like we can meet afterward and make sure you understand what you said.
Yeah, I think generally we're gonna go on what the governor has said, because the public expectation is going to be that this is what we're doing. Unless there's something that's really concerning, and we'll talk, Liz and I will talk in more detail with her team about those things. But generally our approach is going to be to, when the governor announces something and gives a date to it, if it's just guidance related, then we're going to follow what the governor says. Executive orders are a little bit different because that has the force of law. So, but they've been a little bit more timely in updating executive orders than they have guidance. So we'll talk through it and we'll have more info after we do. But I think generally we're going to be following the timelines that the governor announces.
Okay.
Which is what I was expecting as well. You know, so that would mean that as of April 2nd, if you have testing, you can have a 500-person wedding. So anyway, it's pretty amazing what all has been announced with just in the press. So should be interesting to see what happens locally.
Okay. Ed?
Can counties go beyond what the state does in their restrictions? Meaning do less, like have more restrictions than the state, or do they need to abide by the state?
Well, in theory, we can always be more restrictive. The challenge is that there is an executive order that doesn't allow counties to issue their own executive orders without getting approval from the Department of Health. That went into place way back at the beginning of all of this, and it's still in place. So in theory, we would have to get DOH approval to do something more restrictive. But generally, you know, counties can be more restrictive. You just can't be less.
But in this case, we wouldn't be being more restrictive than the actual guidance that's available on the New York State website. So it's a grayer area, right? So it is, I think there is a question as to how you interpret everything that's out there.
Yeah, I'm sorry, Ed, if you were saying more restrictive in that we would do less.
No. Do more. I mean, I'm sorry, be more restrictive and not let people congregate as much as the state does. Right.
Yeah. And quite frankly, I don't know that we have evidence here that we're different in some way that we would want to be different than the rest of the state, right? If we had, you know, cases that were, or an infection rate that was way beyond what any other county was seeing, that would be a different conversation. But I think at this point, we're comfortable with where our disease levels are, that we would want to follow whatever state guidance there is.
I think Liz and Frank are very attuned to the risk that we have with these, with guidance, which loosens up what we heretofore have been doing, and lest people misinterpret the loosening of guidance to allow just about anything. I think that's one of our main risks, is that people will say, oh, well, you know, the barn door is open, so we could let all the horses out. And in fact, what we're talking about is maybe having a little corral outside that barn and yet keeping things under control. So it's a challenge.
Yeah. Okay, great, thanks. Any other comments or questions?
I'll just say we will be posting this on the website within a day if anybody is interested. I just need to make sure we're all on the same page with what information we're posting.
Okay. Thank you. All right, the CSB report, Frank, or Sam, I don't know if you want to just briefly touch on this. There wasn't an actual meeting. We had a joint meeting where I don't know if you want to take it from there, Sam or Frank, have talked about the integration process. Yeah.
Yeah, please. So at the last week, I guess it was Friday, maybe the days all run together. We did have the joint meeting of the two boards to present the strategic plan. You should have received a subsequent documents from Sam through Karen following that up. But you know, I think. I hope you all are as excited as we are that we have this plan. I think it's only improved every time it's been iterated throughout the process, and that's really created a strong place for us to build from. So we're going to be launching in the next few weeks some cross-functional teams to start working on some of the priorities to begin implementing some of it. I'd also point out that there are activities that are going to come out of the strategic plan very specifically because they were identified, but we also have our other work that has to be done, right? I mean, we're still going to have environmental health programs. We're still going to have a mental health clinic. All of those things have to continue, but now we're going to be building and improving them with a foundation, with a new mission, vision, and values for our organization. That's really, I think, going to put us in a strong position, one, to integrate, and two, to provide all of our service with health equity at its core. So we're excited about it. If anyone has any questions or comments, we're happy to take them here, or please send them in, after the meeting via email. We're open to any feedback or input, and it's obviously a living document, but we're excited to start moving it forward.
Great, thank you. Does anyone have questions on that or feedback on that? If you were on Friday, you want to address? Okay, so that's ends our reports. In terms of new business, we do have an enforcement action this week. And Liz, before we put this under motion, just because it's a little bit different than what I think we've seen before, because it's related to enforcement of state guidelines, the New York Forward guidelines. Is there anything different the board needs to understand before we move forward, or it's the same?
Are you asking me to explain if there's a difference in the process, sort of?
Or just there's anything not the process of voting, but is there anything about it that we need to understand that's different than how you normally do enforcement actions, I guess is the question.
For what the board is doing, there is no difference.
Okay.
How this one got to the board is unique, right?
Okay.
It's the first one
So let's wait on that. I just wanted to make sure there were no process differences that we need to be aware of before we went forward. Okay, so we've got a resolution here related to Plum Tree Japanese Restaurant. Is there someone willing to put a motion forward to approve as written? Okay, I've got a first from David and a second from Sue. And so let's go ahead and open for discussion. And Liz, can you just give us the background on this?
Yes, this is a restaurant in College Town, and it is the only facility where we have received, where the sheriff has responded, the sheriff's department has responded to a complaint and issued, they have a process where they developed during COVID this public health warning form for if you weren't wearing masks, you weren't wearing, if you weren't social distancing and, capacity limits and that types of thing. And so this was the first report that where it was against for a facility that where it was the violations were clearly observed and clearly marked, right? This restaurant was operating with it was crowded conditions well and above their capacity limits of 50% or 33%. I forget what it was at the time. And so the sheriff documented that when we got their report, we issued public health director's orders that required them to revise their plan and immediately comply with COVID guidelines. So that part was handled through the public health director's orders. And so the main change in the Board of Health resolution is we are also assessing a fine, and the board is the only body that can assess the fine. And then we incorporate all of the actions taken into the Board of Health order. We had a discussion, they signed, the stipulation agreement and everything. We did have an office conference conducted using language line with them. So we're comfortable that they fully understand the situation and they have been, cooperative throughout this.
Okay, and go ahead, Sue.
Liz, is this a first time offense? So with restaurants, you often, give them a warning and then recheck them. But in this case, for these overcrowding, it's just one and done.
We did take that action with this one. It is extremely rare that we get a law enforcement warning issued, right? So we did view this differently than our standard our standard practice where we do an inspection and then they have to, immediately correct the violation. So we know they've at least made the change in our normal process. In this case, they were issued a warning, and that's all that we know about it. And we did feel like this was a very significant violation, right? We also do take that into account in how we are addressing things. And, there was pretty blatant disregard for capacity limits in this situation. So we did feel like it was warranted.
Okay, other questions? So, and Liz, we arrived at that fee based on what? The penalty fee based on what?
That's pretty much the standard fee, for the Skip has that formula thing, but there's this was intentional and significant. So that's
okay.
Fee is $500.
Okay, right. And I think that was really my question, was that this is within Skip's formula. That's what my sense was, but I just wanted to make sure that I had that correct.
Yeah.
Okay. Okay. Any other questions? Comments? Okay, all in favor as written? I think that's unanimous. Anyone opposed? Yeah, abstentions? Yeah, I think that was unanimous. You all switched on the screen on me since the last time we voted, so just wanted to make sure. All right, my friends, is there any other new business or anything else we need to discuss?
Yeah, Christina, just real quick, Harmony just hopped on board. Harmony is our new Deputy Mental Health Commissioner, so I wanted to introduce her to the board. She started with us a week or two ago and has hit the ground running, helping downtown with the mental health department. She's been a part of some of the strategic planning conversations, and so I invited her here to at least make an introduction to the board. So I just wanted to welcome Harmony to the team.
Hi, Harmony, welcome. Thank you for coming to join us.
Thank you. I'm glad I was able to get in on the meeting. And apologies for getting here later than I anticipated. But
No,
good to
it's
meet all
great.
of you.
How are things going in your first couple weeks?
Oh, it's been really great. I've been meeting a lot of people. I'll probably have to re-meet them all when it's in person, because everyone's like a little postage stamp. But
Yeah.
it's been really exciting to get to meet so many people and hear about so many really wonderful programs, and knowing that we're just going to do more and better things ahead as we continue to get through our current crisis, right? It's
Yeah.
exciting to see so many things happening at the same time. I don't know where people are finding the energy, but it's there. There's a lot of people doing a lot of great things.
We're all going to need like a 2-month vacation by the time this is done, but we'll get there, right?
Yeah. I imagine everyone's going to want the same time off, right?
Yeah.
Just rush. Yeah, sure.
Well, great. Well, welcome from all of us, Harmony, and thanks for taking the position. And you're right, it's sort of an exciting time both for public health and mental health, and it's great to have someone of your caliber on board. So welcome.
Thank you very much.
Okay. All righty, everybody. Is that it for us? Any other new business? Frank, anything aside from that? All right. Are we ready to adjourn? All in favor of adjourning? Yes. Any objections? Anything else we need to talk about? Okay. We'll see everybody next month. Thank you.
All right, have a good weekend.